All right, guys, welcome to a very special episode of Fresh Air, where we have our usual Fresh Air pulmonary pathologist. So there's Dr. Irene Sansano from Barcelona, Spain. The Dr. Sharada Nagoti is with me in person. So she is visiting Cleveland Clinic here in person, all the way from India. So she's with us. And then Matt Cecchini is the Master of Ceremonies, as usual, from London, Ontario, in Canada. And then we have a very special guest today. It's Dr. Leslie Tolle from the Cleveland Clinic. He's my dear colleague, and we've worked together for many years. He's an ILD pulmonologist who does both interstitial lung disease as well as critical care, and is currently the interim head of our ILD group. So I work very closely with him, and he has kindly agreed to chat with us about IPF and things other questions as they might come up. So I would welcome Dr. Leslie Tolle. So welcome, Leslie. Welcome to our discussion.
Thank you. Thanks, everyone. It's great to be here.
So the first thing, Leslie, I wanted to ask you, just as a starter, can you tell us something about yourself? Where you're from and so forth, and then how your journey began into interstitial lung disease. How did you come to becoming an ILD guy?
Yeah, so I'm born and raised in Michigan, and so I'm a huge Detroit sports fan. And because of the proximity, I did a lot of my medical training at University of Michigan. And so from an ILD perspective, it was a little bit of nature versus nurture. They have a large ILD program at Michigan, and so that's sort of what piqued my interest when I was a fellow there. And so that's kind of how I ended up here. And then I moved to Cleveland 11 years ago, and I've been in my current role now for 3-ish years, give or take.
Yeah. So, and in your current role, Leslie, do you see, I know you see a lot of ILD patients. I mean, that's, I don't know how much of your work is that, but then you spend some time in the ICU and you also see sarcoid patients. Is that correct? So is that all three things, or how is it made?
Yeah. So I definitely see ILD patients in clinic, a significant number, and then I have some general pulmonary patients in clinic also. And then my inpatient time is in the ICU, and then part of that time I serve as the ILD resource when I'm in the ICU. So we sort of act as a liaison between the inpatient team and sort of the ILD world when they have ILD cases on the inpatient setting and they sort of don't know how to manage them, work them up if they need any help. And so it's sort of a nice little niche that we've created for ourselves.
Yeah. And in terms of the group can you describe for us our ILD group? Like how many docs are in it? Do they do pure ILD or do they do other things? And then, roughly how many ILD cases do we see a year? Can you give us some like sense of what you guys do as a group?
Yeah, so we have a very large ILD group. So there's about 14 doctors and 2 APPs. That's like as large as some pulmonary divisions. And most of us do ILD in general, but some of us have specialties in other things, bronchoscopy, things like that, et cetera, ICU. Um, we are seeing somewhere in the like 5 to 6,000 cases a year range. We generally have about 40 to 50 new ILD cases a month and another 50, give or take, sarcoidosis cases a month. So I mean, we're seeing pretty heavy volume between ILD and sarcoidosis.
Wow, that's very, very impressive. Very impressive. So as you know, Les,